3 months later, Miss Brown comes back to the clinic and with a smile on her face and her mother at her side states,
"I'm pregnant! Woo!"
She states she feels just fine and doesn't even feel like she is pregnant.
Woo! I'm pregnant! Congratulations, that's such good news.
Yeah, I really want this to work out, and I'm a little bit nervous about it.
That's understandable.
Yeah, but I knew I was pregnant because of my elevated hormone levels.
So that's good. The IVF, after you have IVF, your hormones should be elevated. Your HCG and estrogen and progesterone levels should increase.
Well, I haven't had my period in a couple of months. I've been tired, I've been vomiting, and my breasts have changed.
Those are all some indicative factors of presumptive pregnancy, but those don't necessarily guarantee that you're pregnant. So not having your period for a while, breast change, fatigue, nausea, vomiting, those things that you just mentioned, as well as vaginal and cervical color changes or fetal movement. At this point, you might start to feel some little movement, but those aren't necessarily indicative or guarantee that you are pregnant. There are also some probable factors that you're pregnant, but those aren't a guarantee. We can't say that you are for sure pregnant if you are experiencing abdominal enlargement or cervical softening. In our previous exam that we did the ballottement where we had the baby rebound from your cervix. But that's still not a guarantee that you're pregnant, so...
Oh, okay, interesting.
Do you know what the baby will look like right now?
From your IVF test, you are 8 weeks pregnant.
Oh, great!
Yes,
I'm pregnant!
From 0 to 8 weeks, right around that time is when the heart starts beating in your baby, in your fetus. Wow. And there's organ development, and then after the 8-week point, we have spinal cord. The spinal cord stops at the end of the vertebral column, so that's how long it's going to be in your baby at that time. Taste buds begin to develop, eyelids fuse, so your baby might look a little bit like an alien at this point, but it's going to develop into a beautiful little baby.
Oh, of course.
Yes,
It probably looks like your dad right now.
Oh. So my friend was talking about this new blood test that I could do to find the sex of my baby early. Could I maybe look into that? As well as some genetic testing I heard is available.
So there are a few genetic tests. We don't want to do them too early, specifically amniocentesis, because that can lead to some misreadings or things like that. However, there are a few tests that we can do. The multiple marker screening test, a test for Down syndrome, which because of your advanced maternal age, you are a higher risk for. And there's also the multiple marker screening test, also tests for neural tube defects and chromosome abnormalities. So that's a test that we can do.
What kind of test is that?
It's a simple blood test.
Oh, okay.
Yeah, between 16 and 18 weeks. So we will have to wait a little while longer to be able to do that test. So the test is considered positive if the maternal serum and amniotic fluid levels, as well as the estriol levels, are low, and then your HCG levels are high.
Okay.
Yes. We will also do chorionic villus sampling between 10 to 12 weeks gestation. Timing with these tests is very important. That way we can make sure that the test results are accurate. We don't want to misdiagnose anything or have any other complications with the baby. There's also amniocentesis, which I mentioned earlier. That's 15 to 20 weeks. And both of those tests test for fetal chromosomal abnormalities, metabolic and DNA, things like that. Okay, so at this point in your pregnancy, it was my suggestion that we do an amniocentesis.
Ooh, these needles are pretty big. It seems scary. Is that safe?
So the purpose of the amniocentesis is to examine the fetal cells present in the amniotic fluid to determine if there are any chromosomal abnormalities. So the procedure, basically what you'll do in this procedure, you're going to lie down flat on your back with your tummy exposed, and we're going to put a few towels underneath you just to shift your weight. That way the uterus will be away from some major veins and arteries in your midsection.
That's good.
We're going to take blood pressure, That way we can establish a baseline, and fetal heart rate. That way we can establish a baseline before we do the test.
Okay.
That way, after the test is finished, we can make sure that you and your baby get back up to the point that you were at. We'll take an ultrasound to determine where the baby is in your belly and where the most pocket of amniotic fluid is in the sac. That way we don't have any issues there. We'll clean your stomach and apply some local anesthetic, and at that point you will feel a little pinch and some pressure, but it shouldn't be horribly painful.
Okay.
Then a 3 to 4 inch needle is going to be inserted into your stomach, into the amniotic sac, where we're going to take out about 20 milliliters of amniotic fluid, and we'll run tests on the sample that we take from there. You can resume normal activity after 24 hours. The advantages of doing the amniocentesis are it's a relatively short and painless procedure. Like I said, you may feel a little pressure and pinch, but it's not horribly painful. There have been very, very few complications reported with this procedure, so that's really good.
Okay.
Yes. Risks involved with this procedure: there is a pregnancy loss rate of less than 1%, so very minuscule, but it is still present. And transfer of fetal blood to maternal circulation is also a risk. So that's all the information that I have for you today. Do you have any questions?
I don't. You've done a great job of letting me know.
Good. I'm going to call in the nutritionist nurse, and she's going to speak with you a little bit about your diet and things like that. But let me know.
Thank you.
I will be seeing you.
Yes, you will.
Hamburgers, Coca-Cola, getting gas from too much soda. Double, double, chunky, chunky. Hope this meal is never over. The world is round, and so am I.
Hi, I'm Serena. I'm the nutritionist who is here to evaluate your diet of the last couple days and determine if it's good, if it's healthy for the baby, and if you need to change anything.
Okay.
So I see that you have breakfast, which is very important to have, but I also see that you have coffee.
Oh, I love coffee.
Caffeine isn't the best for the baby,
Oh.
so you should try and drink more water, less coffee. Try to get like a more balanced diet with this, as you have a bunch of fried foods. It's not so good. So have your more fruits and vegetables, grilled chicken, grilled fish, lots of grilled anything is pretty healthy. But definitely drink more water.
Okay.
That's one of the big ones that I see here. So I see that you're doing like pretty big dinner menus. So I think like having smaller meals like throughout the day would help keep your hunger at like lower. Having berries, apples. Do you have any questions?
I don't think I do.
Okay, fantastic.
Thank you.
At 28 weeks, Miss Brown had an episode of abdominal pain and scant bleeding that occurred 2 weeks ago. She was admitted to the perinatal high-risk department at Huntington Hospital, and multiple uterine fibroids were diagnosed. She was then sent home after there was no continued bleeding and asked to be on bed rest for 2 weeks. Since then, she has had no pain and no bleeding.
Hello, Mrs. Brown.
Hi.
How are you doing today?
Okay, this bed rest is getting pretty old though.
Yeah, I know. I'm sorry to hear that. You were diagnosed with uterine fibroids, so we do need to just keep you on bed rest, make sure everything's going okay. But I do have some news for you about your pregnancy. It's some good news if you'd like to hear the sex of your baby.
Yes!
You are having a girl.
Aww.
Yeah, it's very exciting. So there are no chromosomal abnormalities. We learned that through the amniocentesis that we did at, about 15 to 20 weeks.
What a relief.
Yeah, from the last time that I saw you. So I'm just going to speak with you about some risks that are associated with your uterine fibroids that you were diagnosed with. So one thing that you want to be aware of is that you may develop anemia, which is where your blood doesn't really carry iron well anymore, so you may become a little dizzy and things like that, but there are some things that we can do to help you with that. There's also bloating. You may experience some bloating. I see that you are showing now your baby. Yes. Thank you so much. You may also experience some dilating of your ureter, which is where your pee comes out of. So you may have to go to the bathroom a little more often, which is normal.
Oh, I go all the time.
Yes, and then you may feel pressure in your pelvic area, but that's normal with uterine fibroids. So I just wanted to let you know that those are some risks associated with that, but there are things that we can do to help you.
Fantastic. Thank you so much.
You're welcome.
I'm Jay. I'm your midwife.
Hi,
for your
Jay.
labor and delivery for your baby. So I'm just here to go over your birthing plan
Cool.
with you. Just looking at it right now, I can see that you do want an epidural
I would love an
For your-
epidural.
for your delivery, which is awesome. Also, you summarized that you want your mother and father and a close friend present with you during your labor, which is great to have that support system, obviously. You are having a baby girl, so we don't have to discuss circumcision. And Hep B vaccination, I'm really glad that you agreed to consent to your baby having a Hep B vaccination because your baby is in a very fragile state because her immune system will be very underdeveloped, so she's very prone to infection disease. So this vaccine will really help her in the long run. I can see that you do not want a C-section.
I do not. No.
Yes. Well, I just want to let you know that with any pregnancy, as stable or as normal as it looks like or as it can be, there's always that possibility of unforeseen complications that happen, such as you as a mother may become in distress during the pregnancy, or the baby herself might develop a slower heart rate. We call that bradycardia, and in that time the baby is in distress. We have to perform a very emergency procedures to get the baby out. So just to let you know that there are some complications that could come up during the actual delivery, just to have you aware of it, so
Okay.
you're not completely surprised that the doctor says, okay, we have to do a C-section.
Okay, great. Yeah, because with my history of anxiety, I really don't want anything
Of course.
unpredictable to happen.
Of course, yeah, and we will do our best as one team to make sure your delivery is very smooth and it's very safe for you and your baby.
Okay.
I can tell and see that you are, at this time, you do not want to do breastfeeding.
No, I don't. I don't have time. I gotta go back to work. I'm just gonna formula feed.
Okay. Just to let you know just the advantages of breastfeeding. Obviously with breastfeeding it has more nutrition for the baby compared to formula you can buy at the store. So it's a lot more nutritious for your baby, and also through the breast milk there are your antibodies in that milk as it passes on to your baby, so your baby will develop immunity to certain diseases
okay.
out there because you're passing on your antibodies to your baby. And also that skin-to-skin contact is also very important.
Yes,
for
I do
you
want
and
that.
And the baby. So I could recommend, if you are very time pressed, I know you're very busy with your job, but you can try pumping. And you could pump that whenever you want. You could do it when you're getting ready to go to work in the morning or at work, and just getting a few packs in there and just refrigerating that. Once you're all done, then you can give that to your baby when you come back home, or to the nanny, whoever we take care
Yeah,
of your
I'd be
baby.
interested in that.
So other than that, I don't see anything peculiar. Is there any other questions you have for me as your midwife?
I don't. Just make sure the epidural happens.
Of course, sounds good. Well, it's great meeting you.
Yes, meet
I'll
you
see you
soon.
soon.
No one told you life was gonna be this way. Your job's a joke,